Welcome to Bloomington Today. I'm Kaylin Cockrell. Thanks for joining us. The City of Bloomington's Finance Department is again receiving a considerable amount of recognition for its fiscal responsibility and high-quality communication, ranking them among the best in the nation. This was made apparent at the October 3rd City Council meeting. City Budget Manager Cindy Rollins was on hand to accept the Government Finance Officers Association Budget Award in front of the City Council.
This award represents a significant achievement by the city. It reflects the commitment of the governing body and the staff in meeting the highest principles of government budgeting. In order to receive this budget award, the city had to satisfy nationally recognized guidelines for effective budget presentations. Therefore, it is my privilege to present to Cindy Rollins and the Bloomington City Council the Distinguished Budget Presentation Award. Congratulations.
This is the 15th consecutive year Bloomington Finance has been honored with the GFOA Distinguished Budget Presentation Award. Only 20 other Minnesota cities received the award this year, and it's definitely something to be proud of. City Public Health has teamed up with Bloomington Schools to promote an international event that works to create safer routes for walking and biking while increasing physical activity in children. If you were driving through Bloomington on October 5th, odds are you saw quite a few kids walking or biking to school. That's because Bloomington Public Schools was recognizing International Bike or Walk to School Day.
International Walk in School Today is a tremendous effort to encourage kids to walk or bike to school. Here's what we know. We know a lot of the traffic in the morning is due to commuting to school. If we can reduce the number of cars on the streets, we can not only make it easier for people to get to work, but also promote the wellness of children.
Bloomington Mayor Gene Winstead joined the staff and students of Oak Grove Elementary School, greeting hundreds of students as they walked or rolled to various participating elementary schools. In the U.S., more than 3,500 schools participated, walking together with children and adults in 40 countries around the world.
Bloomington has had a tremendous history of working with the public health, and Karen Zelznak, the director, and our superintendent Fujitaki have long been concerned about how to improve the health of children. So together, these kinds of partnerships are things that we want to do to promote the wellness of children.
The Walk to School events don't just bring together parents, teachers, students, and community leaders. The goal of these kinds of celebrations is much more defined.
We know this generation of children has a lot of potential, and we want to make sure we can turn the tide against some of those statistics we hear about the health outcomes for children in later life. If we intervene early and capture them now, we know we can make a big difference.
Principal Yu said that a total of 115 students biked or walked to school that day. That's about 30% of Oak Grove Elementary's total enrollment. This was made possible through assistance from the statewide Health Improvement Program, or SHIP, Bloomington Public Schools, and Bike Walk Twin Cities. Last week on Bloomington Today, we brought you news of the city's plan to keep students more safe while encouraging physical activity by highlighting the Safe Routes to School Sidewalk Improvement Program. Today, we'll show you how the city has gone one step further in one area of Bloomington. Take a look. Every day, kids cross West 106th Street in front of Oak Grove Middle School on their way to class or home from school. And thanks to recently installed signage, those kids will now be better protected. This isn't your average pedestrian crosswalk. This is called a rectangular reflective flashing beacon.
Studies were done and it showed that it had a lot more driver compliance for yielding to pedestrians because of the increased visibility. So the students or any pedestrian pushes the button, it then reacts with the flashing yellow beacon, and that really helps create awareness that the pedestrians are there.
Marone, an engineer and a parent, says the new crosswalk system was needed at the intersection.
This is a location where we know students are crossing, and it doesn't seem reasonable to expect them to walk almost a half mile to the closest traffic signal. So we wanted to provide some type of pedestrian safety enhancement.
Drivers need to be aware of what to do at this particular kind of crosswalk while also obeying Minnesota state law.
It's a legal crosswalk, So in the state of Minnesota, drivers need to yield to a pedestrian that's in the crosswalk. So that means you need to stop for the pedestrian until they have gone past your lane of traffic. So you can start driving after the pedestrian has safely cleared your lane. For pedestrians, we want you, and this is state law as well, you push the button and then you step out when there is an adequate gap.
Motorists can expect to see more of these crosswalks in Bloomington. There will be another rectangular reflective flashing beacon going in at West 102nd Street outside of Jefferson High School. The City of Bloomington has partnered with Tree Trust to plant trees in one area park. Dozens of volunteers gathered at Marsh Lake Park on Saturday, October 8th to plant trees. Approximately 40 trees were put into the ground at the event. Their turnout included individuals, families, and small groups of all ages. Staff from Tree Trust and trained volunteers were on hand to teach volunteers the do's and don'ts of correct tree planting. That looked like a great way to spend a beautiful Saturday. And Tree Trust is always looking for volunteers for other events. Log on to their website at www.treetrust.org to find out how you can get involved. And from bringing trees to life to facing a destructive insect that harms many Minnesota trees, another St. Paul neighborhood as the site of a new emerald ash borer infestation. And Bloomington maintenance staff want to remind residents the do's and don'ts when it comes to this exotic beetle. So hopefully we can halt the spread of this insect and protect our city's trees.
If the emerald ash borer is going to move on its own, it can only move about a half a mile a year. So the spread would be extremely slow, and it would certainly give us a chance to kind of try to control it and do things. But what happens is we as humans spread it. We haul firewood, we haul infected wood or whatever. And so that's probably how it got from the Milwaukee area of Wisconsin all the way across Wisconsin to eastern Minnesota.
Tiny in size but destructive in nature. This tiny non-native beetle was first found in Minnesota back in 2009 and has shot from Ramsey County to Hennepin County to Houston County to Winona County, and now, most recently, back to St. Paul.
Well, the active season for the emerald ash borer is generally thought of to be May through August. That's when we don't want to do anything to ash trees. We don't want to trim them, we don't want to remove them, we just as soon leave them alone.
The Minnesota Department of Agriculture estimates that millions of ash trees across the country have fallen victim to emerald ash borer. And if proper precautions aren't taken to stop the spread, millions more could be infested. To help ensure that doesn't happen, follow the guidelines set forth by the professionals.
We're in a quarantined area in Hennepin and Ramsey County, which means any ash material of any kind, whether it's lumber, trees, logs, branches, can't be moved out of Hennepin and Ramsey County. And that also goes for any hardwood species of firewood. They can't be moved out of those counties, and that's probably the way that it's going to get moved. So we need to be aware of that and keep all of those materials in the quarantine counties.
The city's website has links to the Minnesota DNR, the Department of Agriculture, and more if residents should have questions or concerns about emerald ash borer here in Bloomington. And in other outdoor news, emerald ash borer isn't the only thing causing a potential threat to your shrubbery. Winter can be equally dangerous.
If we get some real extremes, especially the cold weather, that can be extremely difficult. And then if you couple that with some harsh winds in the winter, that can be extremely hard on plant materials, trees and shrubs.
The city of Bloomington experienced the driest September ever on record. Edwardson says residents need to be watering now until the first big freeze.
The trees will take up that water, and obviously in their roots and in their branches and everything, it's the food for them. It helps them stay strong throughout the winter, so it's kind of helps them store energy to when they go dormant in the winter to be ready to wake up again in the spring and be healthy.
The metro area has not seen this year's hard freeze just yet, so make sure you're out there getting your trees and shrubs lots of water while you still can. Now it's time for a short break. When we come back, we're joined by a public health specialist to talk about flu season and the city's emergency preparedness system if a medical outbreak should ever occur. Stay right here.
For the trees on our street.
At my campground.
In my woods.
For the trees in my backyard.
I promise.
Promise.
We promise to not move firewood.
Because the emerald ash borer beetle could be inside.
I've seen what he can do to trees.
I won't be the one to spread the beetle.
Friends don't let friends move firewood.
I won't move it from my backyard to my cabin.
Or bring it home from camping.
I won't take it here or there. I won't take it anywhere.
I'll only buy it where I'm gonna burn it.
Or buy it from my local guys.
I promise.
For the ashwood in my guitar.
For the love of the game.
The wood stays put.
I promise not to spread the beetle.
For the trees in my state.
In mine.
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 In America.
We promise to not move firewood.
We have the power
To stop the beetle.
Join us at stopthebeetle.info.
How do I enroll in Medicare?
What's covered?
How much does it cost?
Are my prescriptions included? Are there penalties for not enrolling? Why is this so confusing?
Medicare can be confusing, but resources are available to help you make confident decisions about your health coverage. Take the time to educate yourself about Medicare.
Learn more. Visit ncoa.org/Medicare or MedicareMadeClear.com.
Welcome back to Bloomington Today. We are now joined by Lisa Brodsky. Lisa is the city's Public Health Emergency Preparedness Coordinator. Welcome to the show, Lisa.
Thanks for having me back.
Well, thanks for being here. So, there's been a lot of buzz about the movie Contagion, and it follows the rapid progression of a lethal airborne virus that kills within days. So, I guess what we want to talk about today is kind of the myth, fact versus, do things like that actually happen, and what do we do? So, would we ever have to worry about the scenes depicted in that movie actually happening?
Well, Contagion, although it's a work of fiction, it really is, it's not a documentary. Nonetheless, it does really present a scientifically credible scenario. It really could happen. As a matter of fact, in the last 100 years, there has been several pandemics. Most well-known is the 1918 Spanish flu, which killed approximately 25 to 50 million people worldwide. And since then, we've had some other ones, 1957 Asian flu, the 1968 Hong Kong flu. Not as virulent, didn't kill as many people, but still a pandemic, so it did affect the entire globe.
What is a pandemic? Do we know the epidemic, pandemic, all words that are kind of thrown around with this movie? What is a pandemic?
A pandemic is really when it's widespread, person-to-person transmission, and that really could spread quickly throughout the world.
Okay.
And more in particular, it's a new virus, typically a new virus that we haven't seen before, so we have no immunity.
Okay.
So yes, it technically could happen, and this one in Contagion was really an unusually virulent infectious disease.
Okay. What is our ability to respond to an outbreak like that we found in the movie Contagion?
Well, typically it takes 5 to 6 months, if it's a new virus, to create a vaccine. So in the meantime, until a vaccine is created, what we would be doing would be recommending social distancing. We could close schools, cancel events, possibly cancel public transportation, really focusing on minimizing the spread of infectious disease, but really have been doing a lot of preparedness planning over the past 10 years, both at the state and local and national level, and plans are in place, protocols are in place, we've practiced, we've exercised, and we really have a solid foundation built in order to respond to that kind of event.
Okay. Well, it kind of leads into the next question then. How would this response kind of be put into motion? How do we get the ball rolling if, God forbid, something like this happened?
Well, the movie in this case did a fairly good depiction of what some of the things are that we would do. If we started to see clusters, we would notify Minnesota Department of Health, who would notify the CDC, and It really focused on a lot of education during this movie. They showed us an alternate care site being set up, and that is set up when hospitals become overrun and clinics become overrun and they need an additional place to put sick people. So we have alternate care sites plans written. We practiced it. We have several identified throughout the metro area. And we also have very detailed plans on mass dispensing. You saw some mass dispensing in the movie of vaccine, of food, of other services and products that people need. So we do have some really detailed mass dispensing plans written. And we work very closely with the CDC on the Strategic National Stockpile, which contains a large amount of antivirals, antibiotics, personal protective equipment, masks, gloves, whatever we may need in such an emergency. And these are strategically located throughout the United States. And if we ran out of supplies, our governor could call for a Strategic National Stockpile pushback, which would be here in about 12 hours. Wow. So a lot of plans are written. It's a really partnership between the local, the state, and the federal government.
All right. There are certain things that the city obviously does to prepare for this. What can residents do to not only prepare but prevent an outbreak like this from happening?
Well, one of the things that was also actually pretty well shown in the movie, but we often forget, that if everybody's sick, Cub Foods might not have any food on the shelf because the truck drivers are sick. We may run out in the pharmacies. There may not be any Motrin, any Tylenol, anything left in the pharmacies because their supplies are coming from overseas. So they did a really good job of showing that the grocery stores might not be open, the pharmacies might not be open. So it's really important to have stockpiles of food, water, medications, all those things that you might need in your home. And we recommend 9 essential items that a person may need in their home if they're going to shelter in place, if they need to stay in their home, especially if social distancing is highly recommended and you don't want to be in contact with anybody else who possibly might be infected. And also washing your hands. We can't stress that enough. Wash your hands, covering your cough. You know, don't touch your eyes and your nose and your mouth, and as well as staying home if you're sick. A lot of people will feel sick and they'll go to work anyways, or they run out of supplies and they'll go to the grocery store. So they're really, not following protocol that they could be infecting other people. And very important, everyone should really get a flu shot. We're coming on flu season, and the flu shot is a primary defense to getting the flu.
Absolutely. Well, that leads us into our final question. And the city provides flu shots to protect against this virus as the season approaches. And with H1N1 now behind us, why is it more important than ever to be getting your flu shot?
Well, it's always important to get a flu shot. A flu can be life-threatening, especially for certain people, frail, the elderly, etc. Depending on the flu, the actual virus. And it really, each year the flu shot targets what they think is the most likely flu that we're going to get. It's based on what is happening in the rest of the world. And again, it does take that 4 to 6 months to create that vaccine. But this is, it's the best that we have, and it won't protect against like a novel virus like H1N1, although this year the H1N1 is in the flu shot. So unlike, that is what happened during the 2009 H1N1 outbreak. It wasn't in the current flu shot because it was really unexpected. It was a new virus. But now it has been included in the vaccine.
Wonderful. Okay. Well, we'd like to thank Lisa for being here today. There is a flu vaccination clinic coming up here in Bloomington. It's on Thursday, November 10th from 4 to 6 p.m. at Oak Grove Middle School. If you need any more details on where that's located or the times, or if you'd like to find out more about Bloomington's preparedness plan, visit the city's website. It's now time for a short break. We'll be right back.
My name's Eddie Metcalf. I enjoy working in my yard, and I can't do that anymore because I'm missing most of my lung. They did a CAT scan of my kidneys. No more kidney stones, that's the good news, but we found a spot on your lung. That frankly scared the hell out of me. I hadn't smoked in 22 years. How could this happen to me? He said, well, you know about radon gas. Well, I heard about it. He said, well, the second leading cause of cancer in America is radon. 22,000 people a year die from this. I literally left the doctor's office, got a test kit, put it in the house, and our result was 39.8. The upper limit is 4. We got to get this fixed. That was on a Monday, and on Wednesday, our mitigation system was up and running. Well, I think everybody should have their house tested. We'd never known we'd still be living there. I could get another tumor from it. But right now, it's changing my life.
Welcome back to Bloomington Today. It's no surprise, and no one wants to think about it just yet, but another winter is closing in on us, and public health is encouraging residents to have a plan for how they'll continue exercising even after the first snow flies. Walking, biking, pickleball, whatever your spring, summer, and fall activities may be, they don't have to go into hibernation once the weather cools. In fact, you should continue as normal once Bloomington is blanketed with snow. City Public Health Nurse Joan Balfour says there are several factors that keep people from exercising in the winter.
Biggest factors are the most obvious here in Minnesota. It's cold and it's dark. So people are getting up in the morning and driving to work in the dark. They're getting home as it's getting dark, and then the time to exercise is no longer there like it is this time of year or in the spring or summer.
Balfour says no amount of spring, summer, and fall exercise can make up for quitting activity during the wintertime months.
If you, we call it decondition over the winter, then all the positive effects of that exercise really goes away. Within, less than 2 months, a person who just is out doing regular exercise during the spring and the summer will have lost all the benefits in less than 2 months. Then to get back in shape, it can take up to 3 months to get up to where you were in the fall the previous year. So it really does affect our bodies.
Come up with a plan that identifies your personal barriers that keep you from exercising during the winter months and find solutions. For example,
if you don't like the cold, then really try to think of some indoor activities that you would like to do that you can replace perhaps your outdoor activities with. It might be that you're going to the mall before work and exercising. If your workplace has a little gym facility, use it during your breaks or during lunch. Try to figure out how you can make it easier, fit it into your day, or you won't do it.
Balfour also urges residents to embrace an outdoor sport for the colder months. Cross-country skiing, snowshoeing, skating, or sledding are a few fun and easy activities to try out this winter. And it's now time for another City Faces segment, where we take you into a day in the life of a Bloomington city worker and see how they're meeting the city's mission of providing quality services at an affordable price. Today we'll step into the shoes of public health specialist Robin Weissman. Take a look.
As a liaison for the Statewide Health Improvement Program, also known as SHIP, Robin Weissman is very involved in the community.
The thing I enjoy most about my job is that I have a lot of variety in both what I do every day and the people that I work with, which is really enjoyable, working with the people in schools and city offices throughout Bloomington, Edina, and Richfield. And I like it that I'm always doing something different.
The Statewide Health Improvement Program works on making local populations healthier.
We're trying to make changes throughout the community that just make the healthy choice the easy choice for everyone.
Two of Robin's recent projects include efforts that benefit Bloomington students and promote active lifestyles.
Within SHIP, we work in communities, schools, work sites, and healthcare, and I personally work a lot with the schools on safe routes to school efforts. I'm also working on active living.
In 2007, the need for health promotion was determined by the state as a way to address the rising cost of healthcare.
The Statewide Health Improvement Program is a statewide effort. The Minnesota Department of Health made an appropriation of $47 million throughout the state, and all community health boards and tribal governments were eligible to apply for that funding, and everyone that applied received funding. So basically SHIP is everywhere throughout the whole state, which is really exciting that all of these communities are doing a lot of the same interventions to reach the same goals to really prevent obesity and tobacco use.
Not only does Robin promote healthy lifestyles at work, but she also incorporates these values at home.
My favorite thing to do outside of work, I have a lot of interests, but I've been into cycling a lot. I do a lot of biking around the Twin Cities, do some volunteer work with the Bicycle Alliance of Minnesota, so it's one way I can use my skills to help out others with the Bike Alliance.
In working with the SHIP program for the city, Robin is certainly able to fulfill her goal of giving back to the community.
I think just in general helping people, which obviously with the Department of Public Health, I'm able to help a lot of people and different residents.
The City of Bloomington and Hennepin County want to keep residents in the know. The Community Action Partnership of Suburban Hennepin is working with the Volunteer Lawyers Network. There are 2 legal services clinics left in suburban Hennepin County. On Wednesday, October 19th, stop by Bloomington Civic Plaza from 4:30 to 6:30, or on Tuesday, November 15th from 4:30 to 6:30, you can stop by the Community Action Partnership of Suburban Hennepin County's office, located at 8800 Highway 7 in St. Louis Park. The clinics provide low-income clients the opportunity to speak with a volunteer attorney about legal questions and obtain information about going to court. In addition, foreclosure prevention specialists are also available for each clinic to address foreclosure-specific questions. And that's all the time we have for today. To get more information on city projects, parks, road construction, and events, visit the city's website. To check out past Bloomington Today shows or other city productions, visit Bloomington's YouTube channel, accessible right from the city's homepage. That and so much more is online right now at www.ci.bloomington.mn.us. If Facebook or Twitter isn't your thing, sign up for eSubscribe to have updates sent right to your email or cell phone. This is Bloomington Today, a presentation of the City of Bloomington's Communications Division. I'm Kaylin Cockerill. Thanks so much for joining us.